In this video, we will be learning about Vojta Therapy. By the way, the correct pronunciation is Vojta Therapy. Let's begin with the introduction. Vojta Therapy is a neurophysiological approach that aims to modify central motor control mechanisms that influence motor behavior. These are based on developmental kinesiology and the principles of reflex locomotion. We will be looking at these concepts shortly. Now comes the background. Vojta therapy is a foundational concept in neurophysical therapy, especially for children with cerebral palsy, and is based on the idea of reflex locomotion, as I talked about before. And it's also notable that it's even been used for patients with stroke. It was developed by Professor Vaclav Vojta between the 1950s and the 70s, and this principle reveals that even in cases of motor impairment, there are inherent and coordinated movement patterns that can be activated through specific stimuli in defined body positions. So, simply put, we can produce movements even in motor impairments through some kind of stimulation that we'll see later. This ability to provoke motor responses serves as a powerful tool in early diagnosis of motor malformations, allowing intervention within the first 6 months of life. Early therapy using this principle not only prevents abnormal motor patterns from becoming ingrained, but also enhances the child's chances of developing more normal movement sequences over time. So the Vojta principal therapy cycle goes like this. We have to identify the motor impairment, apply specific stimuli. This will activate reflexive responses and thus will improve motor functions and eventually will prevent abnormal motor patterns from becoming ingrained. The key to Vojta therapy is that these reflex movements are not consciously controlled by the patient. Instead, they are triggered automatically by the external stimuli provided by the therapist, as we would imagine. This allows us to bypass any voluntary motor impairments and helps us to directly access motor patterns stored in the central nervous system, regardless of the patient's age or physical condition. Let's jump back to reflex locomotion. It is one of the principles of Vojta therapy. So, it is an involuntary, coordinated, rhythmic activation of skeletal muscles triggered by external stimuli. So, it can be produced through two main movement complexes: reflex creeping, that is activated in prone position, and reflex rolling, activated in supine and sideline positions. So, this reflexes activate motor patterns essential for normal movement and postural control, which can be accessed and retrained in patients with neurological or musculoskeletal impairments. Reflex rolling transitions from supine to sideline and leads to crawling. In a healthy newborn baby, part of this movement sequence is spontaneous and can be observed in approximately the 6th month of life, with a further part of sequence observable in the 8th or the 9th month. During reflex creeping, one arm and the opposite leg are extended while the other arm and leg are flexed with the head turned towards the outstretched arm. The therapist applies pressure to the specific zones while resisting head rotation, which elicits involuntary muscle activation that moves the body forward against gravity. This helps to stimulate postural control and locomotor function by activating bilateral muscle coordination. Simply put, a leg and its contralateral arm support the body and move the trunk forward during reflex creeping. Point to be noted is that the movement sequences are retrievable at all the times. The three main positions, prone, supine, and sideline, have more than 30 variations of these movement sequences, and by combining and varying the stimulation zones and resistance applied by the therapist, as well as making slight changes in directions of pressure and joint angles in the starting position, the therapy can be adapted and specified to the patient's individual clinical picture and treatment goal. This is a picture of the trigger zones in the body as per Vojta therapy. Since Professor Vojta worked in Germany, so a lot of these pictures that are available online are in German language. So the names of the body parts are in German language. But we will be able to understand them. And here it is, acromion. Then the rump zone is actually the trunk zone. Then there's medial scapular border, medial epicondyle of the humerus, anterior superior iliac spine, styloid process of the radius, epineurosis of gluteus medius, medial epicondyle of femur, and lateral process of calcaneal tubercle. To summarize, when the patient is in a defined starting position, applying pressure on these trigger zones will unlock automatic motor responses. Other than pressure on the trigger zones, an important role is played by optimal joint angles in extremities and resistance, where the therapist sets up a resistance against the sequence of segmental movements in the current pattern of movement. For example, the tendency to rotate the head during reflex creeping, as we saw earlier, is resisted and held. In this way, tension in the musculature in the environment of resisted body part increases without further contraction. Along with this, muscular activities in other distal body parts like the abdomen, back, arms, legs are strengthened. Here is the implementation. The therapist applies light pressure or one or more of 10 defined zones on the body, combine it with maintaining specific joint angles and providing resistance to certain movements. The sessions involve activating reflex creeping and rolling patterns in different body positions. Resistance is applied to enhance muscle activation and postural control. For example, resisting head rotation during reflex creeping. Parents and caregivers are often trained to perform these exercises. How is this actually helping in the long run? Applying pressure to specific stimulus zone activates the CNS, eliciting involuntary motor responses. This repeated stimulation leads to neuroplastic changes where the brain learns and can voluntarily execute these movement patterns. And beside motor activation, it also stimulates vegetative and autonomic functions such as eye coordination, jaw and tongue movement, swallowing, breathing, bowel and bladder control. How is it different from other therapies? Unlike approaches that produce voluntary movements like Bobath that inhibits abnormal reflex movements and facilitates voluntary control, Vojta therapy does not practice the movement directly, but it activates innate reflex motor patterns via CNS stimulation. This helps patients regain access to normal movement patterns stored in the brain, like we saw in the mechanism of action, and preventing compensatory or abnormal movement strategies. Things to keep in mind are it requires specialized training and certification that is often provided by the International Vojta Society. I did mention family and caregivers can be trained, but that is to repeat the sessions at home. But the person to prepare the treatment plan, to progress through it, to assess remains a therapist who has a certification in Vojta therapy. Next one, it is best suited for patients with neurological impairments affecting motor control like children with cerebral palsy and post-stroke rehab. And most importantly, integration with other therapies may enhance functional outcomes. Now, the indications. This therapy is applicable to all age groups and a wide range of conditions affecting the central nervous system and the musculoskeletal system. This includes infantile postural asymmetry, cerebral palsy, stroke, congenital muscular torticollis, peripheral paralysis, myopathies and congenital deformities, hip dysplasia, respiratory distress syndrome, postural disorders, and motor delays in syndromes such as Down syndrome. Contraindications are acute, feverish, or inflammatory conditions. The therapy should be avoided during active infections or inflammation to prevent exacerbation of symptoms. Recent vaccination with live vaccines. Typically, Vojta therapy should be postponed for about 10 days after vaccination following medical advice. Pregnancy. Certain medical conditions such as imperfect osteogenesis, as in brittle bone disease, where pressure could cause fractures. Severe heart disease or other serious systemic illness where the stress of therapy might be harmful. What does research article says? There is limited high level evidence. I found this research papers and I will put it up in description for extended learning. These are the references. Again, I've put them up in the description box. That's your 10 minutes on Vojta therapy. Thank you for watching.